Well, we are getting closer to a life-saving drug being available over the counter. You might remember we recently reported on the FDA's decision to recommend Narcan be readily available in places like vending machines and supermarkets. The nasal spray, naloxone, is used to save people who have overdosed. Now, I am joined by Dr. Michael Weaver live. He is a professor of psychiatry and also a substance use disorder specialist with UT Health Houston. Dr. Weaver, thank you so much for being here this evening. It's such an important topic, could save lives. So how big of an impact would it have if Narcan was in places that are so accessible like vending machines?
It would definitely allow it to be much more accessible to people so that you'd be able to access it easily, not having to go to a pharmacy. Then you'd be able to use it for family members, roommates, even strangers on the street if necessary.
So how would this work?
So it's currently available by prescription, although most states in the U.S. have regulations in place that allow people to get it without having a doctor sign a prescription. There are laws that allow it to be purchased essentially over the counter, but there are limitations on it. But an expert panel recommended that the FDA make it over the counter, meaning that it is much safer and allowing it to be much more accessible.
And you talked about the panel making that recommendation. So FDA is expected to make a decision in the coming weeks. Do you expect them to actually move forward with this?
Well, since the panel made a unanimous recommendation, and it was the group of experts that the FDA convened to make recommendations like this, it's likely that the FDA will follow through, but it's a process. It's not going to happen instantly, and the panel did recommend some things like labeling changes and some changes to the directions on how to use it in order to make sure it is as easy and effective as possible.
So what are the next steps? What could we be seeing in the next, I guess, few months now?
So trying to make it as widely available as possible. One of the manufacturers that put forward the application to make it over the counter will be gearing up soon, and there may be a whole variety of venues where it can be available. As you mentioned, vending machines that could be in schools, in civic centers, clinics, just about anywhere. The biggest barrier, though, is going to be the fact that you still have to buy it. It's not going to be free, so it's going to be very important for the organization that have been making it available without cost to still make it available without cost so it is in ready supply for the people that need it most.
All right, Dr. Weaver, thank you so much for your perspective and joining us tonight.
Thank you. My pleasure.